Alhamdulillah. Wassalatu wassalamu ala Rasulillah. Welcome everyone to our episode of Basic Trauma Life Support, which is part of our Save One, Save Humanity, presented by Ar-Rikak. Myself, Dr. Nabil Abdul Rahim, and joining me are my friends and colleagues, Dr. Zishan Ghani, Dr. Noordin, Dr. Vikas Ahmed, and Dr. Nabil. Barakallah feekum. Thank you again for joining us in another episode. And we're very delighted to have all of you here. So let's move straight into our class. The reason we started this course was this ayah from Surah Al-Ma'idah. وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. And whoever saves one life, it is as if he had saved mankind entirely. Also the hadith of the Prophet ﷺ, whoever alleviates the hardship of someone in distress, Allah will alleviate his hardship in the worldly life and the hereafter. So our aim is to become known as lifesavers instead of all the negative names or negative connotations that we get, especially in our time, due to the recent happenings that's been happening. So to break that dogma, to break that Islamophobic ideology, we need to be people who are known as lifesavers. This course is made of 3 parts. As we know, we finished our basic life support. And then we are currently in our second part of BTLS, that is basic trauma life support. And then we will have a third part to it called the environmental emergencies and poisoning. Today's objectives are going to be 5 parts. That is a recap of BTLS, fracture immobilization, burns, silver trauma, and finally we'll end with Q&A. Part of a BTLS, that is the basic trauma life support, we discussed that the initial process is going to be the same. That is DRS A, B, C, D, E. D stands for danger and response and shout for help. And then we started with A, B, C, D, E. And that's going to be the main focus today. A, B, C, D, E. And we will have a demonstration now explaining how to go about it. So the initial DRS, we know how it is. So we will ask Dr. Vikas to show us how to move about from A, B, C, D, E. If the person is talking, that is a good sign. That means the airway is open. They're able to talk. That means the airway is open. Then it's fine. All you need to do is stabilize the neck. If they're not talking, if they're not responsive, if they're unconscious, then continue to hold the neck. Let them not move their neck. Okay? And next is if you can stabilize with 2 blocks like this or 2 pillows or any hard substance on both sides of the head, keep the head still, continue with your assessment. So A is airway, you checked, okay. If it's C-spine, airway with C-spine. So if they're not breathing, if they're not producing enough air into their lungs, then you need to give a jaw thrust. How you do that is lift the jaw, the lower jaw upwards. Keep both the thumbs on the chin, on the cheek, and then you can lift with your index finger the lower jaw. Okay? Do not tilt the head. And then after that, that is A. That is just your A part. You're opening your airway, keeping the blocks on both sides. Go for a B assessment. Look at the chest. Is the person breathing? Both sides, is the chest moving equally or not? Okay. If it is not moving equally, then that means the person's had a breathing issue. Okay, some problem. There's nothing much we can do at this point in the outside the hospital. Continue, okay, with the C assessment. C is circulation. Look if there's any bleeding happening in the arms, in the legs, any obvious bleeding that is actually harmful for the patient. So if it's bleeding in the leg, compress it. Take a piece of cloth, compress that bleeding spot, okay, tight and hard for 10 minutes. If the bleeding does not stop, okay, after 10 minutes, then if it's a very massive bleeding, then apply a tourniquet, as we discussed in the last class. Apply a tourniquet and tighten it so that the blood flow is reduced to the actual wound site. All right, so that is your C. And then comes your D assessment. So coming to the D assessment, D is disabilities. D is all about head injury. Is the person conscious, awake? Are they responding to you? Give some pain stimuli to the eyebrows, to the neck. Okay, no response. And then you quickly look at the eyes, both eyes. Okay, if you can just open the eyes a little bit and see. If you see both eyes unequal pupils, if one side pupil is small, one side is big, that means the bad sign of a head injury. There's something going inside the head. This person has to be rushed to the hospital immediately. Okay, that is D. Before that, next, go to E. E is exposed from head to toe. Have a quick look at the body. If anything, obviously, have you missed anything? Any bleeding that is happening that you're not seeing somewhere? Have a quick look at the E. Then cover the patient with a bedsheet, blanket, whatever. Keep them warm, and then wait for the ambulance. Or if your ambulance is not arriving, then wait. You can take the person in a vehicle with the neck immobilized. Okay, so this is the primary survey. All right, it might have looked really fast and a bit confusing to many people, but this is what we are hoping you to learn. Okay, it might take you a few times to actually go over it again, but this is a quick survey. What we've told you. This took us hardly 2 minutes to actually demonstrate, isn't it? This is all it takes, and we want you to learn this to do in 2 to 3 minutes. A quick survey, okay, of a accident patient, okay, of a trauma patient. All right, Jazakallah khair, Dr. Nabil and Dr. Vikas. We will come back to you, inshallah. So, continuing with our slides, I'll start with the airway with C-spine. As we mentioned, if you see someone who's had an accident and who's not conscious, if they're not conscious and they're not maintaining the airway, you can hear some noises in the mouth, okay, or they're not breathing properly. You need to give a jaw thrust, okay, and that is this. You see the first picture, that is jaw thrust. You do not do a chin lift. Okay, you do not do a chin lift because that will damage their C-spine if there is an injury. So you do a jaw thrust. And the reason why I'm showing you this, you can see that some people lift the patient just as, as they've had the trauma, and we're not sure if they've injured the C-spine. That will actually harm their body more. If someone has got a fracture in the neck, if you bend their neck, that will paralyze them for life. If it can potentially paralyze them for life. So jaw thrust is safe. If you do jaw thrust, you won't be moving the person's neck bones. Okay, that is the main objective. Then if you see that the person is talking, okay, and he's saying that there's pain in my neck, or if he's even verbalizing, talking something, if someone is talking after an accident, that is a good sign that the airway is patent. Okay, means for somebody to talk, they need to be having good efforts of breathing. Only if the air goes through the throat, you'll be able to actually produce some sound, and that's why they're talking. So that's a good sign. So in that person, if they're having neck pain, all you need to do is immobilize the neck. First, hold your hands on both sides. Keep something on both sides if you want to free yourself. Then apply straps on both sides to just one on the forehead, one on the chin, so that you can immobilize the person's neck. I hope airway is clear with you. We do jaw thrust and immobilize the neck. Breathing, all you can see is that is the chest moving equally? That is the main thing we want to see. And if you see in the picture on the left side, see the left lung is fully expanded. The right lung is not expanded because there's air around the lungs. This is called pneumothorax. And you can't do much in this. As a public, you cannot do much. All you can see is that the right side chest is not moving much. The left is moving fine. That means there is an injury to the right side chest. you have to take this person to the hospital immediately to decompress. They have to put a hole on the top of the chest to release the air so that the person can breathe normally. Okay. So in breathing, all you are seeing is that are the chest moving up and down equally. And there are signs, like if you see bruises or any stab to the chest or anything, that shows that there is potentially something going on inside. So as a public, all you have to do is just make sure you take this person to the hospital right away. And if you notice, this is how we normally breathe in and out, okay? If you are with the person in the ambulance, or if you're in the car, or if you're with the person who's on the way to the hospital, okay, ideally, if there is oxygen in the ambulance, if you're with the person, okay, if they're not giving you, it's something for you to be aware of, that the person needs oxygen. Any trauma patient needs oxygen first. Okay, the first thing they need is oxygen. Okay, so if you have oxygen in the nearby vicinity, okay, or in the ambulance, provide oxygen first. But after oxygen, you need to, if they're not breathing properly, you need to ventilate them. So ventilation is getting that oxygen into the lungs. The reason I'm saying this, once I saw a person on the roadside, I moved the person into the ambulance. People connected the oxygen. There were 2 people in the ambulance who connected the oxygen to the person, but they didn't ventilate him. So just connecting oxygen alone is not enough if he's not breathing. That oxygen will not go inside the lungs. So they need to be ventilated. Okay, and if you ask what's the normal respiratory rate of a person, it is 12 to 16. So a normal person breathes between 12 to 16 times a minute. And if you see someone breathing in 6 times a minute, that means he's not breathing enough. You need to support his ventilation. Either you can give mouth-to-mouth respiration, or you have to give it a bag. So I also wanted to show that the actual exchange of oxygen does not take place on the top part. It goes all the way inside to the lung, and it goes, happens inside. So it's important that you make the oxygen go all the way in. And if there were questions that what happens if somebody has a cardiac arrest? Okay, you cannot do anything. Okay, even doing CPR is not really recommended as such, because you might make things worse. Okay, so if someone has lost a pulse, in some countries they have the ability to even do an open heart surgery on the roadside. Okay, and they can revive, and that's how progressed. That's how much hospital care or pre-hospital care has progressed in some places. In other places, all we can do is take the person right to the hospital. Okay, but what I put this slide just to show that it's getting better and better as life goes on in terms of medical care. And here in London, they did this in 1989. Okay, 1989 they did a first heart surgery on the roadside, okay, to save someone's life. And it has not caught up in every place of the world now. It's some places do it, some places don't, but it is possible to to revive someone's heart even after a trauma. Coming to C. So we finished A, B, now coming to C, circulation. Circulation is all about bleeding. So as we mentioned last time, if you see obvious bleeding in some part of the body, compress it. Use a cloth, use any object, okay, that is soft, and compress the bleeding point. Hold it for 10 minutes. And 10 minutes means strict 10 minutes. No peeping in between. Okay, some people compress it and then have a quick look inside to see if the bleeding has stopped. No, compress it for 10 minutes. That will stop the bleeding, inshallah. If it doesn't stop, it's in your arms or legs, it's continuing to bleed really bad, and it's not controlled by compression at all, you have to apply a tourniquet, like you mentioned last time. So tourniquet is this, okay, applying something really tight above the wound site. So if it's happening in the leg, you should apply it on your thigh, okay, or just below the knee. How we mentioned last time about this cloth, you can use a cloth, small cloth piece, tie it, use a stick and rotate the stick so that causes a tight tourniquet, okay, around that spot. So that stops the blood flow to the wound site. And this is a temporary measure till you take the person to hospital. And bleeding is a massive issue, okay. If you see this video, okay, this is what actually happens in your lungs, okay. If someone is losing a lot of blood, and you're just standing there and watching, not doing much to stop the bleeding, what is eventually happening is that we need blood to carry oxygen. Okay, that is one of the main functions of blood. Okay, it takes oxygen from the lungs. As you see, these white spots are assume they are oxygen. You see these red blood cells are purple in color initially, and then they turn red once oxygen sits on it. Okay, so they carry oxygen and go to your brain, they go to your lungs, heart, liver, kidney, all your important organs. Okay, if you don't have enough blood, this process is interrupted. They have damage to all the parts of the body. Also, if they don't have enough oxygen, even if they have a lot of blood in the body, this process is affected. So to have, a good healthy organ, okay, support all the way till the person reaches hospital, is to have good oxygen and good amount of blood. Obviously, we cannot give extra blood in the roadside. All you can do is at least stop the bleeding, which is happening. Okay. So coming to D now. So A, B, C is over. Now coming to D, disability. So disability is about head injury. And in head injury, what you're actually seeing is the person awake? If yes, not every person who has a head injury is unconscious. Majority of the people are all right. If you're wearing a helmet, if you're protecting your head properly, or let's say you're not hit your head directly on something, they'll be okay. If the person's awake, good news. Second, if they're not awake, try to ask before you even touch them. Try to alert them by giving a sort of a voice command. Okay, ask them the name, ask them to open their eyes. If they don't respond, then give them pain. Okay, a small amount of pain to make them awake. And even if they're not responding to pain, they're unresponsive. Okay, that is bad. So this grading is like this: A, V, P, U. Okay, so if the patient's unresponsive and they're not responding to pain, that means something really bad has happened in the head. It's just a way for you to understand how bad are the people's head injury. Okay, according to these 4 levels. There's one other sign. If you see someone's eyes, okay, and it's not easy all the time, okay, but it's just an added extra point. Okay, if you can open the eyes quickly and see some obvious unequal pupils. See, this is your pupil. Pupil is your black spot in center of your eye. Okay, if you see one pupil is of one size, let's say 3 millimeters, and the other side is big, 5 or 6 millimeters, you see the difference. If they both are different, that is again a sign of a traumatic brain injury. Okay, if they had a bad head injury and you see this unequal pupils, that means it's a bad sign. Okay, something is happening in the head. There's bleeding happening in the head that is causing this. So to how to give pain, is you can either press on top of your the bone above your eye, or you can give a squeeze, pinch the neck muscles. These are 2 ways to stimulate pain. Okay. So pretty much all you need to do at that time is to take this person immediately to the hospital. Every moment counts when somebody's had a head injury and bleeding inside the head. The head has only so much space for bleeding, okay, to be accumulated. After beyond a point, it causes bad effects. The brain will start to cone below. So you have to rush the patient to the hospital as soon as possible. And in the hospital, we see all this, okay, sort of brain injuries. It's just a picture to show you that in the CT scans, we see all different sorts of bleeding. There's bleeding here, there's bleeding here. And these bleedings are really severe. The bleeding which is happening here is what has caused all the problems. They were not responding because of this. And they might need surgery sometimes, they might need observation. All that will be sorted in the hospital. But remember, this CT scan, the picture you're seeing, okay, can get worse and worse the more you delay, outside the hospital. Coming to concussion, most commonly the concussion will be just with few signs like these. So what I mean is, I know you might be thinking that majority of the people who have head injury, not all of them have a bad bleed, not all of them have a bad sign. Majority of you yourself might have had a head injury at some point, maybe hit your head somewhere or probably fallen somewhere, or you would have seen someone having head injury. And most of them will have these small signs. Some might be feeling dizzy, some will have a headache for a few days, some might be having sensitivity to sound, light sensitivity, some weakness, vomiting. And we see this all the time. There are various different injuries. Someone being hit on the head with a bat, horse kick on the head, fall from a bike, various different forms of head injuries. Okay. And not everybody needs a CT. Okay, you need a CT head. You don't have to rush to go to the hospital to get a CT head done all the time. Only if these symptoms persist for a long time, you need to go get a CT. Okay, it is what I want to convey to you is that most people who have a bad head injury, okay, young person, okay, let's say yourself, then you might be experiencing these signs for the next few days to even few weeks. Okay, so don't be alarmed by it. Don't get worried that you're feeling like this. That's normal. Once the brain has been jolted because of an injury, it is common to feel these symptoms. Okay, and if you have questions on this particular thing, okay, in detail, we will discuss inshallah towards the end. So coming to E. So A, B, C, D, we finished. Coming to E. So this is the last part. This is expose. This is mainly to quickly have an overview of what's happening from head to toe. You've seen the head, you've seen the chest, you've not seen anything else majorly. Okay, are you missing anything is a quick question. Okay, before you cover the patient head to toe, look if are there any obvious injuries anywhere that you missed. Okay, in the foot, probably in the thigh or in the back. Okay, and we've seen, we ourselves have missed many times by not looking in the back. Okay, sometimes we see a wound in the back and you might not have realized it, and he might be bleeding from that point. So before you cover the patient or cover the person, you need to check head to toe quickly. And E is also important to prevent heat loss. Someone is on the road lying down, the temperature is only 20 degrees or 18 degrees. They are losing heat. Remember, when someone is lying on the road or lying anywhere on the floor, they are losing heat by conduction, by convection, by various ways, radiation. They're just losing heat. And why we're worried about losing heat is because there is this dangerous triad. Okay, with blood loss, if you have hypothermia means low body temperature. It makes things worse in your body. You're losing blood and you're becoming cold. That is a very bad sign. So you don't want the person to become cold. You want to keep them warm. And all you need to do is just cover them. Okay, use a blanket, bed sheet, whatever it is. Cover the whole person. Okay, cover them, keep them warm till the ambulance arrives. Okay. But like I mentioned, before you cover them, make sure that you have a quick head to foot examination. Fine. So that's my ABCDE. Let's go into a live demonstration now, inshallah. So Dr. Vikas, you can come in now. Great. Okay. Are you able to hear me?
Yeah, Nabil.
Yes. Okay. So now let's explain this ABCD in a bit slower fashion so that they can understand what it is.
Yeah.
Okay. Right. So starting again, let me make this screen a bit more bigger. Okay. Fine. So I hope the video is clear for everyone. Right. Let's first, we're going back to the same example. Let's say there is an accident patient, okay, who's fallen on the floor, fell off the bike, and you want to go and assess the person first. So we look for danger. We're not going to go over DRS. That's danger. Okay, we're going to check the area is clear. And let's move forward. Check for response first. Okay, so notice how Vikas is approaching. And he's gone and first held the person's neck. And stabilized the C-spine. Okay, and then checking for response. Hello, sir. Can you open your eyes?
Hello, sir. Can you open your eyes?
Yeah. So no response. If they have no response, then what you need to do is jaw thrust. So if Nabil, can you go closer to the face and see how you can show, because you can show how you're going to actually do a jaw thrust. Yeah. So remember, in this method, what he's showing, it's obviously he's not a real human, so it's very difficult to show the jaw. What he's doing is just to lift the lower jaw. He's not bending the neck. He's only lifting the jaw with his two fingers. You can see the index finger below the jawbone. Yep. Perfect. Okay. So that's a jaw thrust. That what it does is opens the airway. So they can now the air can move freely from outside to the chest. I hope the jaw thrust was clear. All you have to do is take two fingers and lift the jawbone. Next is C spine. Okay, to keep the neck immobilized, just keep two hard objects on both sides of the neck. Okay, and apply tapes on the neck, on the forehead and the chin. That is just to keep the neck immobilized, so that we don't want the neck moving. That is A and C. Okay. Just coming to B, you can't do much, but just have a look in the chest if there is any obvious irregularities in the movement. Are the chest moving equally on both sides? If they're not moving, you can just look at it. You don't have to even touch. You just have to see if the chest is moving equally or not. Okay, fine. That means if the chest is not moving, that means something is obstructing the movement into one of the lungs. And then coming to C, that could be a bleeding from anywhere. Okay, so the bleeding from any part of the body. Okay, the first thing to do is take a piece of cloth and compress that bleeding spot right away. Okay, immediately you just have to compress it really hard. Okay, apply pressure really hard and make sure that you compress it and don't look into it. Okay, till 10 minutes at least. So give a hard compression. If you want someone else to do it also, let them continue doing this. Okay, you can continue the other assessments. Okay, so hard compression. After that comes D. Okay, sorry. Before that, before you go to D, we can do a tourniquet. Let's say there is massive hemorrhage and the bleeding is uncontrollable from the end of the leg or from the arms. If it's not working, then you need to apply a string like this or a rope or even a piece of cloth, tighten it really hard just above the bleeding spot. Okay, and then you can use a stick like last time we mentioned. You can tighten it if you want, or rotate it and make sure there is a tight compression at that spot so that the bleeding stops. Fine. So this is C. Then going to D, like I mentioned, you are going to check for AVPU. Is the person alert, or do you need to wake him up by giving voice, or do you need to
Hi,
give pain
sir.
to wake him up? So there's and you see unequal pupils, that means there is a massive head injury. Then you need to take the person to the hospital immediately. And E is nothing much, just checking quickly from head to toe. Is there any other injury? If not, just cover the patient. Cover the person with a bed sheet. Keep them warm. Okay, so perfect. And I think that completes the primary survey. So once you're done this person is being quickly checked for all the potential life-threatening injuries they can have. Okay, from your level, on a public level, you have done your best. Okay, and then you can wait for the ambulance or transport him in a vehicle. So this completes the primary survey. Jazakallah khair, Vikas and Nabil. We'll go back to our demo. In a while, we'll continue our demo towards the end again, inshallah, if any doubts. So now I'll hand over to our brother, Dr. Nuruddin, with this topic, fracture, inshallah. Dr. Nuruddin, are you there?
Assalamu alaikum.
Wa alaikum assalam. Yes, you can share your screen now. Yeah.
Yeah. Okay. Yeah. Am I audible?
Yes, you're audible now. Yeah. Perfect.
Okay,
Yeah.
fine. Can you see my screen as well?
Yes, your screen is clear. Yeah.
Okay, fine. So the next topic is about fractures and burns. So just to remind you, this topic is about how to do first aid for simple fractures, which involves fractures in your arms or your legs. This does not include if there is a potential or a significant injury that involves head or backbone. So if there is an associated injury or if the mechanism is quite severe, get them to the hospital as early as possible, because the more you delay, the chances of recovery is going to be delayed as well. So yeah, so the objectives are: one, we'll be seeing about fractures, which involves the long bones, as I said, the mechanism, what can cause fractures, what are the signs and symptoms of fractures that a victim can have, and what are the first aid measures which we can do before we take them to a hospital, and how to immobilize or put a splint for fractures involving the hands and legs, and especially what not to do when someone sustains a fracture. So fracture is nothing but a break in any bone. So there are lots and lots and types of fractures based on the mechanism, based on the site, and based on the number of bones involved and number of fragments involved. But in simple terms, we can grossly divide it into either open fracture or closed fracture. An open fracture is nothing but where if you are able to see a bone protruding out of the wound, or if there is a deep wound where you can see a bone or an underlying tissue, that means it's an open fracture. As a closed fracture, it can be either a swelling or it can be just redness or a deformity. So the mechanism involves, it can be either a sports-related injury, or it can be motor vehicle collisions, or it can be secondary to fractures involving the elderly people because of various reasons, which Dr. Zishan will be dealing with later. And it can be fractures secondary to calcium deficiency, or if there is any bone disorders, especially in the elderly age group. So what all signs they can have? It can be very obvious that sometimes you can see a bone protruding at the site of injury, as seen in the first picture, or it can be a discoloration like this, which indicates that an underlying blood vessel has ruptured or injured that is causing the bleeding, which can be because of a fracture as well. Or it can be very obvious like a deformity, as shown in picture 3, or it can be a simple pain at the site of injury that can have a hairline fracture as well. So the first aid measures are: one is to control the bleeding. To I'll explain all of this in detail in the upcoming slides. So you'll see one by one. So first step is to control the bleeding, as Nabil has explained in the trauma primary survey, which includes if there is a site of bleeding, try to give direct compression, either using a cloth or a bandage or whatever it is, because a fracture of the limb will um, is not life-threatening, but if there's a significant bleeding, that can be life-threatening. So the main aim is to control the bleeding. If there is an open fracture with the limb or the bone protruding, try not to compress at the site of the protrusion of the bone. Either you can give a compression in a nearby site or at the proximal site, I mean at the site above it, because if you try to give compression at the site of the bone, you may worsen the injury and cause further bleeding at times. So the second one is try not to move the victim unless there is an imminent threat. Like fracture can occur anywhere. It can occur at homes, it can occur at malls, it can occur in playgrounds anywhere. But if there is a fracture on the road where there is oncoming traffic, you can move the patient to a safe area. If not, try not to move the victim, because if you try to move, you may manipulate the fracture, which will worsen the bleeding and the injury. So apply ice packs. Then the reason for applying ice packs is as shown in the picture 2. So if there is a fracture, obviously there will be blood collection around the bone. So when you apply ice packs on to the site of injury, what happens is that this will contract, or this will narrow down the blood vessel at the site of injury, thereby preventing further bleeding. So try not to put ice packs directly. Either you can cover it with a cloth, or you can get those available ice packs over the market and apply it as well. So next is arm immobilization. So the main aim of arm immobilization is to prevent further worsening of injury, and one is for pain reduction till you take them to the hospital. So our aim is, if there is a fracture, let's say in the forearm here, our aim is to immobilize the joint above and below as well. There are a lot of splints available in hospital, but at the site of injury, it can happen anywhere, as I said. If you have two sticks or anything, or a magazine or a cardboard available, you can place them on top and put a bandage or a string around it just to tie it, and then put them on a sling. So this is how you make a sling. It's as simple as you can, if you get a towel or a cloth, you can fold it into a triangular shape. Let's say if the fracture is on the right side or the right hand, you can place the top corner under the arm and place it onto the right shoulder, place the arm on the cloth and fold it and bring the bottom corner onto the left shoulder and tie it together as shown in picture E. This is just to buy time till you take them to the hospital, mainly for pain reduction. So whereas in leg, if you have a long stick available, you can put it on the sides and put a tape or a string around it. Or if there is a cardboard available, you can place it under the site of injury or the deformity, and then put a plaster or a sting, or even tie it with the cloth till you take them to the hospital. So this is how we do leg splinting. So if there is obvious bleeding coming out, you can give compression either with a bandage or a cloth, and then you can put two sticks on the side and then cover it, just to immobilize the leg, and then take them to the hospital. So make sure you take them to the hospital for any fractures, because certain fractures can be managed only by surgical techniques. There are some fractures which can be managed just by giving some pain medication, manipulation, which can be done under local anesthesia, just by giving some medication to put you to sleep, manipulate, and then put a back slab or a plaster. Some fractures need urgent surgical intervention that has to be decided by the doctors. So make sure you take them to the hospital, and it has to be the doctors who has to decide whether what kind of treatment you need. So things which should not be done when there is a fracture. So try not to manipulate the fracture. As I said, you may end up worsening the injury by manipulating and worsen the bleeding. Try not to put tight splint, as this can decrease the blood supply to the bones or to the further part of at the site of fracture. So, and if there is any associated injury like head injury, or if they appear confused, or if there is a severe mechanism involving road traffic accidents or a fall from height, get her help as early as possible and take them to the hospital as early as possible. And as I said, try not to apply direct ice packs. Make sure you cover it with the cloth and then put it at the site of fracture or suspected injury. And if there is a suspected fracture, make sure you not to give them water, or like you can give sips of water, that is acceptable, but don't give them too much of water or food or anything before they are seen by a doctor, because if they have to give you some medication to put you to sleep and do a surgery, it is better you stay nil by mouth. Okay, so I think we'll do a demo about fracture immobilization technique at the end of the burns topic as well. So next topic is about burns and scars. Yeah, so the objectives are about burns and the type of burns, which we know, and first aid measures which we can do for burns before taking them to the hospital. So what do we do differently in case of electrical burns, and what not to do when someone sustains a burn? So burns is nothing but a damage to the skin caused by heat. If it is by dry heat like fire accidents or anything, it is called as burns. Or if it's secondary to a spill of chemicals like liquids, it is called as scalds. So it can be as simple as just discoloration in your hand when someone sustains a burn, or it can cause blisters like these, or it can be sometimes if it involves the deeper tissue or the underlying tissue, it can be black or like this kind of white charred skin as well. So the type of burns which we commonly know is one is flammable burns, thermal burns, Other one can be chemical burns, accidental spin of chemicals, especially in laboratories. And the third possibility is electrical burns. So we'll see one by one in the next slides. So make sure the first thing is ensure the scene is safe before you approach a victim, because burns can occur anywhere, in roads, malls, anywhere. So if there is significant fire, which can produce a lot of smoke, and if you need to make sure that you're safe before you approach the victim as well. So make sure the scene is safe. Next is sometimes if the victim has inhaled a lot of smoke, they can become drowsy or unresponsive as well. So go back to your basics, which is DRS ABCD. Check for danger, as I said, which is saying safety. Check for response. If the patient is not responding, go back to your ABCD and call for help as early as possible. So next, you can cool the burns under running water, which is only for milder form of burns, which is just discoloration or redness. It should not be done for open wounds because it might worsen the nearby tissues and decrease the chances of healing. Make sure you cool them under running water at least for 10 minutes. No need to apply for cold water or anything, because that can damage or worsen the injury as well. So running tap water is more than enough, and make sure you cool it at least for 10 minutes. So next, when someone sustained the burns, make sure you remove the jewelry as early as possible, because when someone sustains a burn, it can cause swelling of the nearby tissue. So let's say in this picture, if you see, you can see the swelling of the fingers as well as the hand. If the ring is not removed or cut off earlier, this can decrease the blood supply to this part of the finger and can worsen it. And at some point, you may have to cut off the finger as well. Third is cover the burns with a cling film if available. The reason for applying cling film is one is it stores the moisture and prevents it from drying out. And other thing is it prevents chances of secondary infection if they're exposed to air. And it helps in pain reduction as well. So make sure you can cover the entire site of burns with a cling film before you take them to the hospital. So in terms of painkillers, you can give them paracetamol. Preferable dose is 2 tablets of 500 milligram, or if there is a 1 gram of paracetamol available. And if it's a minor form of burns, it can be managed at home. If the pain is severe, you need to take them to the hospital to be seen by a doctor. So whereas in electrical burns, make sure you turn off the power source before you do anything or before you even touch the victim. And in terms of medical help, any chemical or electrical burns, like spill of chemicals or electrical burns, needs to be seen by a doctor, because they may appear superficial, but they can be deeper injury as well. So make sure you take them to the hospital and are seen by doctors. And if there is a large or a deep burns, when I say large, if it is more than a size of the palm of the victim, that means it's a larger burn that needs to be seen by a doctor. So make sure you take them to the hospital. If there is a charred skin or white skin, as I showed in the initial picture, of any size, that indicates that there is injury or burns to the deeper structures. So make sure you take them to the hospital. And if there is burns involved in the face, hands, arms, extremities, or the groin, with or without blisters, that needs to be seen by the doctor. These burns cannot be managed at home. And if someone has breathed a lot of smoke or fumes, make sure you take them to the hospital, because that can cause drowsiness. This inhalation can cause decreased oxygen level in the blood as well, and they can go in for drowsiness and coma. So make sure you take them to the hospital if they appear confused or if they complain of headache or anything. Please take them to the hospital. The things not to do when someone sustains a burn is don't use ice cold water. Running tap water should be more than enough. Don't treat the open wound with the running water, that it may damage the tissues left over. And don't apply any butter, ointments, or spray. Two reasons. One is it will be difficult for the doctor to examine because sometimes it may get stuck to the wound or the burns. And second one is it may delay the healing process. So try not to apply any of those. The simple thing is apply a cling film and take them to the hospital to be seen by a doctor. And if there is a cloth or something that is stuck to the wound, try not to remove it. You can take them to the hospital and they'll be able to remove it by giving adequate pain medications. And try not to break any blisters or anything. So the demo, I think we can go back to Dr. Vikas and Dr. Nabil. They'll explain to us about applying a splint and immobilization technique.
All right. Jazakallah khair. Nuruddin, you can. Dr. Vikas can come on screen now. Great, thank you. Nuruddin, you can actually.
Yeah.
You can coordinate with Dr. Vikas.
Let's someone on the road has sustained a fall and injured his right arm, and there's an obvious deformity. So how would you immobilize them? Let's say it's a closed fracture. There is no open wound or anything, and you want to immobilize the patient before you take them to the hospital. If there's a stick or a cardboard available, or if there is a magazine available, you can put them at the site of deformity and tie it with a string or a plaster, whichever is available.
Yeah. Nuruddin, can you hear me?
Yeah, I can hear you, Vikas.
Yeah. Sorry.
Okay, so the arm is immobilized by putting a cardboard under it, and it's
yeah. So we suspect a fracture in this area. So you need to immobilize this part, and this part.
yeah.
Right?
So the main aim is to immobilize the joint above and below.
So we want to do that here. Silence. Another one. Yeah.
Okay. Okay, Dr. Vikas, that. Thank you. Can you explain to us how to put a sling, how to create a sling as well?
Yeah. Yeah. We can use a normal cloth, a bigger one, a bigger cloth. We don't have all these things. We can use a cloth.
You can take a simple cloth and fold it into a triangular shape.
Yeah. So this is the cloth. So you fold it like this, in a triangular shape. Yeah.
Yes. Yeah.
And we demonstrate on Nabil. So this is the cloth. So first of all, you keep one thing
Yeah.
over the Nabil, and then
And place the hand
use this
in
cloth.
and tie it around the shoulders.
Yeah. Then you tie it.
Yeah. This is just to support the arm till you take them to the hospital, and it helps in reducing the pain to a significant amount.
Yeah.
Okay.
Another thing, if you have a sling-like thing, you
Okay.
can use this. You can make one like this. Okay, it's called sling. So you
Yeah.
can
This
just
is like
tie
a
one,
cuff and collar.
okay, and then you tie another one.
Okay. Fine. Can you explain to us regarding immobilization technique for leg as well?
Yeah, definitely. Okay. So suppose if say Nabil's leg is got injured and he have a fracture over this area, okay, middle of his leg. So what you're going to do is take any rod or or any plaster. Okay, you're going to immobilize his both sides. Okay, you're going to be stationary like this. Okay, make sure it doesn't prick anywhere, and then going to tie uh, any rope kind thing to make that just one thing, make it like this. And another one like this. So now they lost not going to move his leg until
Yeah.
the rope is terminated. Don't make it too tight. Okay. Always ask if it is too tight. Nabil, is it too tight? Okay. Okay. And you can assess
So,
by putting one finger inside the rope as well. You can put one
so the
finger
main
inside
aim
the
is
rope.
to prevent the fractured part from moving.
Yeah. So you can move his leg anywhere, any direction. You can use just two rods like thing, or else you can use a cupboard like thing underneath so
Yeah.
that it doesn't move.
You can, yes, either a cardboard or a rod, or if there is a thick magazine, you can place that as well under it.
Yeah. These are all household things that is easily available.
Yes. Yep. Thank you. And regarding the application of cling film,
Yeah. So,
so
cling film is something which is available at home for packing food. All the same. So it's a plastic thing. So for Nabil have burns here, this part. So you just need to cover it and then cover it with cling film. Then cut all over the area where it got burns. Maybe this area, another one, this area, another one. So on. Yeah, no?
okay, because yeah, that's fine. Thank you. I hope everyone understood this one.
Yeah, I think that was really good.
That's it from my side, Nabil.
Okay, fine. Jazakallah khair, Nuruddin. I think now we'll move on to the next topic of silver trauma. Let's go to Dr. Zishan and let's see if we can demonstrate to us what silver trauma is. I'm sure not many of you would have heard this term called silver trauma. It's a relatively new term, but it'll be something interesting for all of you to learn, inshallah. So I hand over to Dr. Zishan.
Assalamu alaikum wa rahmatullah. Bismillah ar-Rahman ar-Rahim. So I have a very short topic today. It's called silver trauma. Now, many of you might be wondering, what is silver trauma? Is it about money? No, it's not about money. So I know it's a very interesting term. You must be wondering, what does this even mean? So it's quite simple. Silver trauma means trauma which is found in the elderly. All right, people usually above 65 years old, because once they get older, they get gray hair, whitish gray hair, and that's the reason why they call it silver trauma. It's just like a nickname. When you hear silver trauma, it's all old people. Now, old people undergo, they are quite prone to a lot of injuries, um, because their eyesight is poor, their balance is not proper, and as you get older, you get a bit more weaker, isn't it? So with good healthcare, we have a lot of people reaching old age. Uh, we have a bigger number of old age population in our country, especially in India. I think 50 years back, 100 years back, people would live up to 50, 60 years only. That was enough. That was all. But now we have people who are living up to 70, 80 years old. Now, when you have a bigger uh, number of older people, yes, you will get a bigger number of accidents involving them as well. Now, remember, the more serious injuries you get, the more higher risk of you dying. And because old people have a very sensitive body, I'll be coming up to that. I'll show you. Their injuries can be even more dangerous. An injury is as simple as falling from standing from a height, walking, standing. What do you call? Standing position itself can cause serious injury. You can have injuries in the brain. You can have injuries, anywhere else in your long bones. All of these things can happen. Now, although there are a lot more things that can happen with old people, because we are only talking about trauma, I'll try and simplify it into four types. Head injury, neck injury, hip injury, and other types of injuries. Okay, I'm not talking about the medical part. Yes, people get cancer, diabetes, heart attacks, infections, pneumonia. Those things happen with old age. It's part of life. But we are only talking about injuries now. Okay, so the first one is head injury. Now, Dr. Nabil had showed some images of head injury. People must have been wondering, okay, what really happens in a head injury? Um, Remember, in simple way to classify it is there can be two types of head injury. One can be, if you can see my mouse here, an open head injury where you see something being hit on the head and you see blood coming out. You know that gives you a sign that is this a clue that is this an open head injury. Normal times, some people just get a small bruise and they're fine. All right. But an open head injury is if you see an actual object going into the head. That's dangerous, open head injury. Closed head injury is something that happens inside the brain. Now, this is more difficult to see because obviously you can't see inside the head, right? So in these cases, people often get injuries outside, like a bruise on the face, on near the ears, back of the head. They might get a bruise, and you might think, okay, it's probably nothing. But with old people, you have to be careful because the injury that can be happening inside is even more dangerous. Okay, now look at this picture. So the first thing, what happens is when a person hits his head, the brain inside tends to bounce forward and backward. Okay, and this our skull is a very small, tiny chamber. So the moment something hits with pressure, there will be bleeding on the inside. Okay, and remember, with old people, their brain size slightly shrinks. Okay, that's part of human development. Because it shrinks a little bit, it tends to bounce around more inside the skull, and that's why it can bleed more. So all the blood vessels that's connected will start bleeding, and this is what happens. When you hear people saying there's a blood clot in the brain, blood clot in the brain, what's happening is this is what is actually happening. There you can see this blood clot hematoma. There is blood collection there that is creating pressure inside the brain. Once pressure starts increasing, they'll start vomiting. They might become unconscious. They might go into coma. And when it reaches a very high pressure, they'll stop breathing and they will die. That's why it's dangerous. And with old people, it's sometimes you will not notice in the beginning, but you will start seeing that their behavior is changing, they're becoming confused, headache, they can't see. This is when you should be worried. Another important thing is old people have heart problems or bleeding problems, and they take tablets like these blood thinners, to fight against clot, like aspirin, ecosprin, they say in India, or warfarin. these tablets tend to make your blood more, I would say, watery, slippery. And so the moment you have a tiny cut, it starts bleeding uh, very fast. That's why in some in our emergency medicine, if an old person taking these blood thinners has had a head injury, we will be really suspicious about his injury. And sometimes we even do a scan for his head just to make sure there's no bleeding inside the brain. All right. So if this happens to someone you know who's taking blood thinners, he's got a big head injury, you should be worried about him. All right. If you think he needs a scan, go show it to the doctors and they'll advise you. The next is neck injuries. Okay. We So the other thing with neck injuries is, look at this picture. The bones become very soft as they get older. Now this injury can happen to young people also, but in old people, it's even more common. What happens is this is called a whiplash injury. Now, when you are traveling in a bike or a car, and the person suddenly puts a brake, maybe they hit something in the front, they hit the car in the front, you know, you are wearing a seat belt. If you're not wearing a seat belt, it's even more dangerous. But if you're wearing a seat belt, your head and neck will suddenly get pushed forwards. And just like, a whip, how they hit animals with a whip, it'll flex back again. Sort of like a rubber, when you just uh, push something and then leave it, it just bounces back in front. And this is what happens to your neck. And when that happens, look at this. There's tearing up of the neck muscle ligaments, sometimes even bone, and that can cause nerve injury. If nerve injury happens, a person can get paralyzed in some parts of the body. That's dangerous. And it's even very, very common with old people, especially when they fall down the stairs. Okay. Now, neck injury, if you see in people, I know it's a big topic. What you can do is tell the person don't move. If someone has had a neck injury and they fall down and they say my neck is paining, they say it's paining very badly, you need to go to the hospital. Now again, I understand going to the hospital takes 15 minutes, half an hour. At least what you can do is make them lie flat, put two pillows or put a towel around their neck and just tape it around their chin or the forehead so that they don't move the neck. The main point is to not move the neck. The more you move the neck, the more chances you will press on the nerves or you will break some part of the bone. And that happens, the person might be permanently paralyzed. We have seen this in a hospital. It's not nice. I've seen young people getting paralyzed due to spine injuries. It's not good. That's why in trauma care, it's very, very important. Any neck injury, any injury, people just take care of the neck. I know it's difficult in India, especially if you're not a medical person. But if someone has had a neck injury, they fell down the stairs, try to put them between pillows or towels and take them to the hospital. They should not move. If you have this collar like this man is putting, I know it's not the ideal advice, but this is something better than nothing. If you have that collar, at least put that collar, tell him not to move, make him lie down, take him to the hospital. If somebody has neck pain after a fall, they have to go to the hospital. The neck collar is not the best thing. In hospital, we have something different than this, but this is something better than nothing, I would say. If you don't have this, at least put them between pillows or towels and don't let them move and make them lie down flat. So what happens with these bones is, see, look, so if you see this picture, on top, this thing that looks like cheese, it's not cheese, it's actually how our bones look on the inside. Okay. When you're young and healthy, look on the pictures on left side, your bones are quite dense. All right. They're not rock solid. Alhamdulillah, that's how we are created. Because they are porous and fibrous, they are a bit lightweight. And because of this lightweight, we can move and run. Uh, it's not too heavy. But what happens is, as you get older and older, the bones start, there's a process called osteoporosis. Basically, your bones become weak and there's more holes created inside your bones. And when that happens, your bones get very light and your bones get very easily breakable. I've an orthopedician has told me in young people or sometimes even older people, this is almost like cheese. If you have cheese at your home and you cut it, you see how easy it is. And that's how easy it is in old people and newborn babies. That's how easily the bone can be broken. Okay. So if a person falls down in old people, this is the most common thing you'll ever see. Hip injuries, most common injuries. In the Western countries, it's common everywhere. I'm sure in India also it happens, but because we live in big family communities, older people are taken care of by family members. But Western people, because they live alone and independent, falls are very quite common. What happens the moment a person falls down, there's a big pressure formed at the hip. This hip bone can break. All right. It can be fixed, but it does affect your lifestyle greatly. All right. So this is called a femur bone, and that's called the neck. So when the moment the neck of that femur breaks up, a person cannot walk. Anyone who falls down and after that fall, especially if he cannot sit up, if he cannot walk at all, remember, no sitting, no walking. If you can't do any of this, you should think of a fracture. It's better to be safe, do an X-ray rather than say, no, I'll be at home. They don't need a treatment. Let's wait and watch. No, if they fall down, they can't walk, they can't even sit up. You need to go to the hospital. All right. And this is what they do in the hospital. They fix up the bone. You can see how many pieces it is. They put a nail inside. They keep talking about screwing and putting a nail in the hip. This is what they do. This is just one of the surgeries, but they do many, many other types. Sometimes the whole part has to be replaced by an iron titanium piece. Okay. So this is the hip bone fracture. The other fractures are long bones. This happens in young people also, but in old people, very common, especially when you fall down. The moment you fall down, the shoulder bone has a lot of pressure that can break up, similar to femur. When you fall on outstretched hand, stretch your hand. This happens to young people. This happened to me when I was in school. So when this happens, you break the edge of the bone in your hand. This needs plastering. With plastering, it just goes back to normal. Again, with old people, it takes time. It needs to be operated sometimes, but it can be easily fixed. But what are the challenges that happens with these problems, especially with old people? That's why we call it silver trauma. Yeah. The biggest thing is limited mobility. The moment someone has a fracture, all right, hip fracture, they cannot walk. A human being not being able to walk, it is pretty, difficult. You become dependent on someone else. The wheelchair, you need to be pushed. Two simple things like going to the bathroom, you need help. You need to have a frame, you need to have a stick. It can be very demotivating when you are healthy one day and the next day you are handicapped. It is difficult, limited mobility. They can't go up the stairs. They have to live in one floor. The next thing is their regular activities are restricted. Simple thing like wearing shirt. If you have a hand fracture, your arms are broken. You can't even wear a shirt properly. You can't even button them properly because it's difficult. You can't go to the bathroom. You can't brush your teeth. You can't comb your hair because of one part of your hand that's fractured or handicap broken. Even things like writing, some people may not be able to write. Okay. The other thing is just to talk about a medical part. I'm just this is just going through it. When people lie down uh, on their backs for a long time, there's a little bit of water collection and not much airflow to the bottom of the lungs. You can see when he's lying down here and when he's sitting up here. This causes, so imagine water collection, not poor airflow. What happens? Like anything, you start getting infections, like food that you keep. Same thing happens to our organs. Not enough oxygen, too little blood flow. They start getting infections. And this is what happens to old people when they are at home. They start getting pneumonia very commonly. Okay. And this causes more and more problems for their life. They keep on getting infections. Last but not the least is all of these combined, and these cause people depression, anxiety, frustration. So remember this, you've seen all the old people in our family, they have medical problems, especially if they have had injuries. They become dependent. We have all seen this in our lives. They become dependent on people. They need people to help them, to walk, to go to the bathroom, to, sit up, to lie down, to drink water, to eat food. A person who has done so much of things in his life for 50, 60 years, suddenly becoming handicapped and dependent on someone else, it is very demotivating. Even when young people get sick, you see how down we are. But imagine if you're old and people just leave you because you're sick and you're not having enough energy in your body to take care of yourself. This does affect people. The most common problem you'll see in old people, I think this is the most dangerous thing compared to everything else. The things, the problems of being lonely and depressed and dependent on people. As we have hadith, as a Prophet ﷺ said, he is not one of us who does not have mercy on our young and does not respect our elders. So these two are the most sensitive age groups for society. The young people, they need help to grow up. Yes, we love them, we take care. Old people, yes, they don't have anything. They don't have the power that they're young. But one thing that they want the most is respect. To be spoken to nicely, to be taken care of. You don't know. You give this to old people, and this is itself is enough for them than anything else in the world. So that is all from my side. Uh, this was a short topic. Jazakallah khair. I'll be handing over to Nabil now, and we'll be going into question answer session soon. Assalamu alaikum.
Walaikum assalam wa rahmatullah. Jazakallah khair, Dr. Sishan. It was a very wonderful talk. We'll take some questions in the end, inshallah. So we are ending the session now, okay, with the summary. So the main thing, what we wanted to, wanted you to take home is, do not panic when you see someone having an accident, someone who's injured. The difference that you can make is to organize your mind at that moment and go through this A, B, C, D, E. Okay. So, you can revise with this. You can revise. We'll be sending you the slides, inshallah, and you can go through the video as well. It might take a couple of more minutes or hours for you to get the hang of this. But all you need to remember is A is for airway with C-spine, B is for breathing with ventilation, C is for circulation, controlling bleeding, D is checking if there is any obvious head injuries, and E is for extremity, environment exposure, make the patient warm, and you have done your best part, okay, of managing a trauma person before the ambulance arrives, rather than just sitting there and not doing much. This is what you can do at your best, and the rest of it, inshallah, will happen in the hospital. So I hope this was clear. With this, we'll move on to our question answer. I would ask all the participants, okay, to post your questions in the chat box. Keep it coming one by one. As we mentioned before, keep it precise, keep it to the point, okay. Do not repeat the questions if possible, and keep it coming, okay, and keep posting the questions. We will be taking one by one, inshallah. So because we finished the class a little bit later than what we normally finish, we can, inshallah, extend it to 5 or 10 minutes if needed, okay, to answer your questions, depending on how many questions are coming. So I would ask people to, keep the questions coming. And we are happy to demonstrate again if needed anything, inshallah.
Okay, so let me ask the questions. Okay.
Yeah, Dr. Zishan can coordinate it. Yeah.
So I'll start with Noordin, Dr. Noordin. What is the treatment for people who have had ligament injuries with knee accidents? What is the treatment, and how do you give care? What kind of care should we do for those people? This is for Dr. Noordin.
Yeah. So what was the question? Is about ligament injuries, right?
Ligament injuries in the knee. What is the treatment? How do you give care?
Okay, so it depends. So first we need to rule out if there is a fracture or not, and if there is no significant bleeding in the joint. And if those are all cleared, there are some tests which are done, obviously as a part of clinical examination to decide to find out if there is a significant ligament injury An ultimate diagnostic test would be doing an MRI after need to find out if there is ligament injury. So it determines, it depends on the type of injury and type of ligament involved. So basically, if it's an acute injury, what initial advice would be is something, a mnemonic called RICE, RICE, for any soft tissue injuries that does not have a fracture. So basically, you can rest for 48 hours without moving the limbs and put some ice packs to decrease the swelling. And you can give some hot compression after like 24 hours and keep the leg elevated for maybe 2 or 3 days. But if there is a ligament tear or a significant injury without involving the bone, it has to be the bone doctors to decide whether they need a surgery or not. So this topic which we dealt with is only about acute injuries. What can be done in the next 24 hours?
Okay, so
Yeah.
the next question is, thank you, Nurudin. The next question is for Nabil. So if you don't have anything to stabilize the neck, can you just hold with the hands? No. Or that's one question. Related to that is another question, that how do you immobilize the head instead of bricks if you don't have anything with you? What can you use it? Do you use hands or anything else? How do you immobilize the head?
Okay, so holding the neck is with your hands first, as Vikas showed. Actually, we can bring Vikas on screen, inshallah, so it'll be easier for everybody to see as well. I'll stop sharing. Dr. Vikas can come and demonstrate as we talk. So holding the neck is by your hands. Okay, that's your primary thing, because at that moment you don't have anything with you. Okay, so you have to hold both sides of the neck and then stabilize with your forearm the head. So you're making sure that the person is not moving the head. That is the main thing. And those things, the red color things, are not exactly bricks actually. I mean, what I meant, those are shaped like bricks, but if you have something hard like that, you can keep anything hard on both sides so that you can strap on both ends. So the basic purpose is that the neck should not move. You do whatever you want, okay, to keep on both sides, making sure that the head does not turn both sides. Yeah. That'll be enough, yeah.
Okay. Shall I move on?
Yeah, you can move on.
Yeah.
So next question is for Dr. Nurdin.
Yeah.
How will you, can we cover burns with cling films even for small burns at home?
Yes,
For
yes,
small
yeah, you can
burns.
do. That's the main aim. As I said, the main reason for applying a cling film is to prevent further infections. And if it's exposed to air, that can worsen the pain. So it's for pain management as well. So it should be okay. Even if it's a small minor burns, you can cover it with cling film.
Okay. And the other thing is, if you don't have cling film, is any other alternative?
You can cover it with a clean cloth, but the only problem with the cloths is that sometimes it can get stuck to the wound. So if it's an open wound, the ideal option would be a cling film. But if it's a closed wound like a blister or just a redness, you can cover it with the cloth as well till you take them to the hospital.
Okay. Okay. Thank you. Dr. Nabil, so the next question for you is, in point E, where when you're talking about DRS, ABCD, if you have nothing else to cover, what do you do to keep the body warm?
No, all you need is a simple cloth, okay, to cover the body. If you don't have anything, then you can't do anything about it. But if you can afford to take off your jacket, or in terms of your your coat or anything you have, or anything around, you can ask someone, okay, to just a piece of cloth to cover them. The whole purpose is not to let the body cool. If they lose the temperature, they are damaging their blood circulation even further. So yeah, ideally it's a cloth. Yeah.
It's a cloth. Okay, fine. Thank you. Dr. Nudin, so the next question for you is, what if you don't have a sling at all at home? So someone told that they just kept their friend's hand in position without moving till they reach the
Okay,
hospital. They didn't have
fine.
anything. They just
So,
kept the hand in one place without
okay,
moving.
that's fine. The main aim is to keep the hand from moving, or the fractured or the injured part from moving. So if that can
Yeah.
be done even without a sling, that should be acceptable till they reach the hospital.
Okay. So, and the next thing about fracture people asking is, can how do you know some part is fractured or not? And what can there be asymptomatic fracture? How do you know? Like people, some people, some people may fall down and they may not have pain. Can they still be have a can still be having a broken bone? Or some can people have pain for many days and that might still be a fracture. How to differentiate these things?
Yes. So the main thing is regarding the mechanism of injury, like what was the cause, whether it is a fall or if it is a road traffic accident, or and second thing is obvious. It can be there can be an obvious deformity, or a bone can be protruding if there is a fracture. Third, it can be a pain which is out of proportion when there is range of movements, or if there can be a decreased range of movements. If any of these signs or symptoms are present, they need to be taken to the hospital and get an X-ray done to make sure there's no fracture.
Yeah. And yeah, I think I would just like to add to that point to people. See, if you have fallen down and you have a painful bony part of your body and it's getting worse, just go to the hospital and get it checked. It's better to have it checked and get X-ray done rather than sitting at home and letting it get worse. Now I'll ask Nabil the next question. Now I think I'll start mixing up the questions because so both of you can answer. So Dr. Nabil, if people who have neck problems like cervical spondylitis and all, how do you move them from one place to another? How do you shift
You
the
mean that
patient?
you mean the person has had an accident and you know
Yeah.
that the person has a cervical spondylosis.
Yeah, let's just say you suspect some spine injury, or you know that this
Yeah,
man already had some neck problems before. How do
yeah,
you shift actually? How do you take people?
yeah. So that's a good point. Like we said, we have to stabilize the neck. And like if Dr. Vikas can come back on video again, if you notice, he had a board below his head. If to show you, ideally, if there is a hard board below the person, which is difficult, I know, I understand it's difficult for the public to access. But if you have a hard board just under the head, and if you have two blocks on both sides of the head, and then they can strap it, you can move the person from one point to another. Let's say from the road to the ambulance, or from the road to the car, okay, or whatever is the vehicle. Like you notice in the video that he has a hard board under the person's head. And how to keep the hard board under the head is just to slide it very slightly. And that time, ideally, one person should be holding the neck, the other person should be sliding the board beneath. Okay, and don't move the head a lot to put the board beneath. Okay, so once that is done, you can keep both the blocks on either side and then strap it. Yeah. So the basic element is, let's say, even if the board is not available, okay, when you move the person from one point to another, make sure the head is not moving. That's it. So one person holds the head all the time. Other people can lift the other part of the body. Okay, that's the main point here. Even in the hospital, we do the same thing. One person is assigned just to hold the neck. Okay, the other people will be doing other things. Okay, lifting the person's torso, legs, and other things. But one person just holds the neck all the time.
Okay, Dr. Noori. Next question is,
Yeah.
how do we recognize brain stroke in people? Stroke,
Okay.
basically, that's the question.
Uh, yeah, that's a question. That's a good question. So stroke can be there's a common mnemonic which we call it FAST, FAST. So it's quite easy. Someone who has a sudden onset of slurring of speech. So that's one sign. That can be a sign of stroke. There can be weakness in the hands or the legs. That can be another sign. Third, they can be droop or facial droop, that if they try to eat or drink something, they can be drooling of saliva or food on one side of the mouth. That can be another sign. So if any of these signs are present, it's better you take them to the hospital within the next 4 hours from the onset of symptoms. So there can be two types of stroke. One, they can be a block in one of the blood vessels which goes to the brain, or it can be a bleed as well. So if it's a block, and if the patient, if the victim is seen by a doctor within the 4 hours, there are chances that can reverse it by giving some medication, which we call it thrombolysis at medical terms, like a blood thinner. But if there is a bleed, that has to be managed separately. So as I said, if there are any symptoms like weakness of the face, like drooling of saliva or anything, if there is any slurred speech, or if there is any weakness of the hands or the legs, or if there is any difficulty in walking, like unsteady gait or unsteady walking, taken to the hospital within the next 4 hours.
Yeah, so I put a picture on the screen. I think that's what he was trying to explain, FAST.
Yeah, exactly. Yeah.
Yeah, and that should be your mnemonic for stroke. The reason we didn't go into details of it is because I assume that most people are aware that someone's feeling weak, they are rushed to the hospital, sooner. But it's a very difficult thing to find out. Some people wake up with it. It's not a life-threatening thing all the time, but it's definitely, it does have an impact. Yes.
Yeah, that is a
Okay,
good
we can
answer.
move on.
I've also given the link in the chat group. I think
Okay.
one thing people need to remember about this stroke is time. If you don't know anything else, just remember time. The moment you see something, weakness or paralysis, whatever, go to hospital immediately. Don't delay. Okay.
Yeah.
Okay. So next question is, what about people who live alone? How do they keep their bones healthy? What to do to keep your bones healthy, Dr. Nabil? And along with that, the other thing is, how do people take care of themselves if they're living alone? In case such things happen. Two
I
questions here.
think, yeah, I think Dr. Zishan, you can answer that. It's something related to your topic. I'll be happy if you can answer. Yeah.
Okay, that's fine.
Yeah.
So, okay, so see, for bone healthy, it's obviously good diet, vitamin D and calcium rich diet. And also in older people, you get calcium and vitamin D supplements. These are also helpful, especially for older people, not for everyone, not for young people, but especially older people who had bone problems. Things like milk, egg, and all these are good sources of uh, vitamin D and calcium. These things will keep you healthy. See, I would say if there are old people living alone and having mobility issues, my personal advice is to not let them go up and down the stairs on their own all the time. Okay, you never know when they might slip or due to eyesight problem. It's better they live on a uh, in a flat level house rather than going up and down stairs. What a person can do if they're alone is, in UK, what we have seen is people have an emergency alarm necklace. So they'll have a wristband or they'll wear a necklace which will have an emergency button. The moment they press that button, there'll be a emergency signal going to the ambulance or to the local whoever is taking care of them in that area. So they will come and check. That's a very interesting concept. I don't know if it is common in India or not, but I would say people can keep something like that with them where they can just keep it on the wrist or necklace or give it to the family members where they can press something, the family members will come. Or the easiest thing is keep a mobile phone, something handy nearby, you know, so you can call someone immediately if you have a fall, if you had a fracture, and if you can't get up. Or if they live alone, let their family members come and check on them 2 or 3 times a day. I understand people may find difficult living with old, sick people all the time. I know some families it is difficult, but the least they can do is come and check on them 3 times a day, 2 times a day, so everything is fine. Because the biggest problem is we have seen is people who had a fall or have gone unconscious and no one came to check on them at all, and many of them died like that. There's a lot of sad stories. So this is what we don't want. Let someone come and check you every few hours, or you have a phone with you so you can call him immediately. Um, okay, now I'll ask Dr. Nudi the next question. Um, how do you immobilize an open fracture? What do you do with open fracture where something's open and there's bone sticking out? What do you do then?
Yeah. Okay, it's almost the same like a closed fracture. The only difference is try not to give compression if there is bleeding at the site of where the bone is protruding. You can give compression at the nearby places, nearby areas, and the site of immobilization. I mean the way of immobilization will be the same. put two sticks at the sides and try to put a tape till they take them to the hospital. Because if you try
Okay.
to push the bone in or try to manipulate it, it will worsen the injury and increases the chances of further bleeding.
Okay. Thank you. Dr. Abil, someone has asked a question. What is difference between providing oxygen, providing ventilation?
Yes, yeah, I saw that. This is, I think it's been asked the second time now. So let me just share the screen at the moment. I go back to that slide. So oxygen, like I mentioned, is, you're inhaling an oxygen by yourself from the air, or if you don't have enough oxygen, you're not able to do that, then somebody provides oxygen from the outside. Okay, and that is, not possible by everyone. Okay, not everybody can give oxygen. Okay, except the people who come with oxygen cylinders in the ambulance. Ventilation means you can see the screen. It's the lungs expanding. Okay, so ventilation is actually making the lungs go inflate and deflate. That's what you're trying. It's like a balloon. Okay, so ventilation happens only when air goes in, makes the lungs become big, and then you breathe out, the lungs become small. This movement is required for the oxygen to go into the deeper parts of the lungs, and then that will get into the blood. If you give only oxygen and the lungs are not moving, that means they're not ventilating, then the oxygen will not go into the deeper part of the lungs. Okay, so that is the difference. That's why I said oxygen and ventilation is required. It's like only if you ventilate, the oxygen is pushed into the lungs. I hope that is clear.
Okay. Next question for Dr. Nudin. It's a simple question. What about when something's fall on the head and then there's a bit of swelling? At that point, what do you do? So they're mentioned
It
as
depends
rise
on.
of muscles. It's not muscles actually. It's just a soft tissue that is swelling up.
Okay, fine. So it depends on what falls onto the head, onto the forehead. If it's just a soft object, or if you just bump your head, and if you don't have any risk factors, like let's say someone who is elderly, more than 65, or someone who is on a blood thinner or something else, the chances of having an underlying or deep injury is very less likely. So in that case, if they don't have any severe headache which is not responding to painkillers or anything, they need to be seen by a doctor. If not, you can just give compression with ice packs just for the swelling to come down and take some painkillers, and that should be fine.
Okay. What else?
Can I answer one thing? Like,
Yeah, go
there
ahead.
was an earlier question about jaw thrust, and somebody asked how many times we should do the jaw thrust.
Oh, yes. Yeah.
Okay. I think this we were not. I'm sorry that we were not clear about it. Okay, jaw thrust is not one-time thing. You have to maintain in that position. If Vikas can come again in video and just show if you're free, that jaw thrust is something you have to continue to do until the person is able to breathe by himself, or something else is there in its place to make him breathe. So if you leave the jaw, the person will start snoring again, or probably the air entry is reduced again. They won't be able to breathe properly. If you lift the jaw, they're able to breathe in properly. If you leave the jaw, they're not able to breathe properly. So it's basically you're supporting their airway by lifting the jaw. So if you leave the jaw, again the airway is obstructed. So because they're not conscious, they're not able to hold their own airway, you're supporting the airway by lifting the jaw. Just want to bring that into the spotlight again. I hope everybody can see. So yes, so again he's holding the thumb, and you lift the jaw and you stay in that same place. Sorry, is there a flickering happening with the video?
Yeah.
1 second, sorry.
It's I
Sorry,
think it's a
yeah.
network bandwidth, I think. Yeah.
Okay, fine, that's all right. Okay, yeah, that's all we wanted to say. That make sure that jaw is kept up until the person is able to breathe, until the ambulance arrives. If it's not maintaining the airway, you have to continue to do that. Okay, thank you, Dr. Vikas.
Okay. So next question is,
And we'll take this as a last question, inshallah, and then we can continue in Google Classroom or in the WhatsApp.
Okay. What about people who have lumbar spondylosis? What about them? So the question is not very detailed. What do you mean? After they had an injury or they had a fall or just general pain? They haven't spoken about that, but anyways, either of you can answer that question. If they had a fall after a lumbar spondylosis.
Okay, I think he's just clarified saying it's after a fall. So it's the principles apply the same. Okay, you have to immobilize the person, and it depends on how bad the fall is. Some people just have a catch in the back; they can't move, and could be a spasm. So they still have to go to the hospital and get checked. If they're an old person, like how Opposition mentioned, they are prone to fractures. You have to get an X-ray of the back, sometimes a CT to check if the bone is broken or not. So it's important. If they have spondylosis and they had a fall, they're having a pain there, you have to take them to hospital. Yeah.
Okay, thank you.
Someone's asked about oximeters. Yes, you can use oximeters, checking breathing. That should be all right, I think. Is there anything else you wanted to add, Dr. Zishan?
Not much from my side. I hope it was helpful for people. Today was too much information. Apologies for that. But this is all for people's good. And the recording will be available.
Inshallah, the recording and PPT will be available. Yeah. So, inshallah, we'll end the session today. It's been a long class. So, inshallah, the next class will be on November 15, inshallah. And so we finished our basic trauma life support. The next class will be on drowning, heat stroke, frostbite, snake, scorpion, insect poisonings, and other chemical poisonings. This is all related to environmental and environmental and poisoning harms that can happen. So inshallah we'll join you in that class, and we'll also try to revise these topics if you need to next class, and keep our questions coming in Google Classroom and WhatsApp, please. That's your space to discuss. So remember to keep yourself safe first and practice all these things as much as you can. And inshallah, we'll keep a quiz on this as well in the near future. So it'll be useful for understanding. Jazakallah khaira for attending. Subhanakallah wa bihamdika. Ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk.